thank you all so much for joining us tonight for our Zoom town hall on mental health during a pandemic. I wanted to, I'm Elizabeth Beck. I am a candidate for House Representative, State Representative for House District 97 at Southwest Fort Worth and Tarrant County. But I don't come to you tonight as a candidate. I come to you as someone who is like yourself at home in your living room, or maybe your son's room, or whatever room in your house has the best lighting, right? The reason that I wanted to put this together is because as we have moved through this global pandemic, I've seen a lot of people host town halls and meetings about, various different topics. But the one that I hadn't seen people really, or anyone focus on, was how this was impacting all of our mental and emotional health. And that was something that I felt, I know that I have struggled with during this time, and I know that I'm not alone. So I really wanted to, one, share my story so that people know that it's okay to share your story, that you aren't alone, that you can seek help, and that that everyone is there with you in some way or another. And then to bring some professionals on to talk about what they do and what they've seen during this pandemic, and then give you some ideas for what you can do at home, or maybe when you need to get some additional help. So what really did it for me, and when I realized that that I was struggling with what was happening around me, was about a week into it when I couldn't sleep. There were several nights in a row that I was up at night, tossing and turning. 1 o'clock rolled around, 2 o'clock rolled around. I had this very uneasy feeling. And so finally I reached out to my therapist and I said, something's going on. I'm not sleeping, and that's not like me. I need help. And so we sat down and we talked about it. And what we realized was that it was the images of the grocery stores with all of the shelves bare, and the news story after news story about the run on grocery stores, and this, the food supply chain and what that looked like now. And what that did for me was brought up some experiences from my childhood where food insecurity was prevalent. And I watched my mom struggle to make sure we had things like bread or milk to get us through to the next payday. And so the idea of not having enough food for me or my daughters brought out anxiety and fear that I would experience that same feeling that I did as a child. And so I worked with her and was able to kind of put that to bed and move forward. And so I know that I'm sure that I'm not alone in this. And so I'm really excited tonight to have several people on this Zoom town hall to kind of talk about what you can do if you find yourself in a similar situation. And so I have Dr. Brian Dixon. Can wave, Dr. Dixon. This is Dr. Brian Dixon. He is from Progressive Psychiatry. He is also a fellow Aggie, so Yegum. And then we have Anastasia Taylor-Stas, who is the founder and executive director of Alliance Child and Family Solutions. And then we have Sammy Graham, who is a music therapist with Heart and Harmony. And so they will be here tonight to answer any questions that you may have. If you missed me earlier, we're going to control who is muted and unmuted while our panelists speak, just for the ease of the flow of the conversation. But if you have any questions that you want to ask, go ahead and throw them into the chat feature, and I will make sure that as time permits, we're able to get to those. So with that, I would like to pose my first question to my panelists. And that is, for each one of you, I want you to tell me about your specific profession and how that fits into the grand scheme of mental health. I'll start with Dr. Yes.
Awesome, great. So first off, thank you again for having me on this lovely afternoon, and thanks y'all for taking the time to learn more about what we do and how we can all be better stewards of our mental health, as well as do our civic duty. So as a psychiatrist, it's really strange that I have these degrees behind me, because normally I don't even have them in my office. But to become a psychiatrist, you go to undergrad, do your 4 years, you go to med school for 4 years, and then depending on what type of psychiatry you want to do, you do a residency, which is basically on-the-job training. It's like super intense on-the-job training for 4 years if you want to see adults, and for 5 years if you want to work with kids. We are trained in therapy in many of the basic therapy modalities. There's, I think, over 100 different versions. We get trained in 3 to 5. And then we are also taught how to use medications and use those safely. So the goal is to make sure that people feel better without causing any other unnecessary side effects. And so that's the really fast version. Most psychiatrists, some of them work in groups. So like with MHMR or Cook Children's, that sort of thing. Some psychiatrists will work in private practice, which is what I do. And I have the best job in the world, and I'm very, very thankful for it.
Awesome. Stas?
All right, so I will jump in. I'm in outpatient mental health counseling, which means it's the one-on-one counseling. When you go to talk to someone, it's not inside a hospital. Usually it's in clinics or private practices. And just to kind of shadow what Dr. Dixon talked about, for our education, what we have to do is 4 years of undergrad, approximately, 2 years master's degree. Then afterwards, you have to get a license and pursue another 2 years of supervised clinical experience. Once you have that, then you can take the test and be able to practice independently. Without that, you can't hold yourself out as a counselor, therapist, or social worker. Now, I know I mentioned 3 different titles. Those are all different degree fields, but they all do very similar things. And so you might hear, well, I want to go to a counselor only, or why would I see a social worker if I need counseling? All of us, even though we went through different degree programs, do very similar things. We just had different backgrounds and focuses when we went through our education. And so that's a little bit about what we do.
Awesome. And then Sammy, tell us a little bit about music therapy, because when I hear music therapy, my mind goes to that playlist that I put on in the morning when I'm singing in the shower or dancing around my house. So what exactly is music therapy?
Absolutely. Hi, everybody. I'm really excited to be here. So a lot of us haven't heard of music therapy. It is a newer field. It was established in 1950 after World War II, when there was an influx of veterans coming back with PTSD. People were volunteering, playing music, and just seeing the effects that it had. So people wanted to research that more, and then it became a field of study and a practice. So before I tell you a little bit more about what exactly music therapy is, I'll go into the training required. So I did receive a degree in music therapy. It's a 4-year degree plus a 6-month internship, and then you sit for the board certification exam. And then with most things like that, there's continuing education and things like that that we have to do. So as you mentioned, we all kind of use music instinctively in these, different ways throughout our lives as therapy. A lot of people, when I tell people I'm a music therapist, they say, oh, music's my therapy. It's all of ours. We're humans. And there's a few different reasons for that. But namely, the biggest thing is that music is accessed in every major part of the brain, which means that it has really far-reaching effects. So, for example, sorry, I lost my train of thought. So yeah, neuroplasticity. If you've not heard of that, it's brain's ability to create new neural pathways, and we need dopamine for that to happen. And music releases a lot of dopamine for us, also like oxytocin, which is a bonding hormone. So we're essentially using music to achieve non-musical goals. So any form of therapy you can think of, whether that's speech, physical therapy, psychotherapy, we're working toward the same goals, but using music to achieve that, because we've studied music's effect on the brain. It is important to know, though, that we are not all speech therapists, physical therapists, and counselors. A lot of music therapists do achieve those other credentials, but by and large, we are co-treating with other disciplines just because the addition of music as a supplement can be really beneficial for some people.
Awesome, thank you. So I think I can speak for most people on this call when I say this is my first global pandemic. And so I think that brings on something different for each of us. So I would like to know what are some of the things that you have seen either in your practice or maybe in literature or trade articles that have been coming out about how we as a society and individually, how our mental and emotional health has been impacted by what's happening around us.
So I'll jump in first. So one of the difficulties with this particular situation is we don't know where the end is. And so I think we as human beings are really good at kind of, if we see where the cliff is going to end, we can go, okay, well, let me gauge how far I need to be, or if danger is coming, let me figure out what I need to do to prepare for something that I don't have control over. Well, in this sense, we don't know where the end is, and it's very it's an invisible enemy in a sense. And so, viruses do not have. Viruses don't know what race you are. They don't care what race you are. Viruses just do what viruses do. And so as a result, we spend a lot of time worried and fretting. And since we don't know where the end is, it's very kind of unsettling. And so that's what I've seen a lot of with my parents that I work with the kids that I see, is that everybody has this, it's kind of like trauma that continues to kind of reset itself each and every day. And so, which is why it's really important that we get the word out about what this virus is, what we can do, the things that we can do to try to get some control during that.
Awesome.
Yeah, so this is Stas again, and just jumping in on some of the things that I've read about, that I've studied about with how it's affected mental health. When you look at overall the statistics that are happening at this time, one of the things that was posted was that calls to the U.S. helpline jumped 891%. That's a pretty big percentage. I mean, I wish my income would jump that much. So when you see how big of an effect it is having over everyone in the country, all different ages, backgrounds, circumstances, where either it's bringing up trauma that some individuals were not aware of, or it's just hard in general. There's also reports about how medications rose 34.1% in anti-anxiety medications. And then as we see the effects roll out on our economy, we're seeing lots of mental health issues that are coming from that, where unemployment, kind of the food insecurity that you mentioned at the beginning, all of those things are going to play out. And we've been somewhat in a crisis mode where we can acknowledge that it's difficult and that it's hard, but we've really been going with adrenaline. And what happens when we start to get to a status quo where it's still hard and it does become the new normal, I think that's when a lot more mental health issues will arise as well.
Thank you. Sammy, do you have anything to add?
Yeah, just a little bit. I think the thing that I've noticed really for me personally, and the thing I've seen with a lot of people, is just trying to adjust to this, normalcy being ripped out from under us, right? Everything about our daily lives, our routine, our schedule. We don't realize how important that is for us and our mental health and our stability until it's gone. And, this is new for most of us. So navigating that, I think, for a lot of people is difficult. Whether you have a diagnosis or not, I think most people really, really are just used to having a structure and a routine. And it's hard to find that now. And so in addition to all of the uncertainty for the near future, it makes sense to me that just that lack of normalcy is a big issue for a lot of people.
Thank you. Dr. Dixon, I wanted to, everyone has touched on anxiety on this call, right? I think we've all used that word. Tell us exactly though what that means. What medically does anxiety mean? Does it mean that, I had one sleepless night, or does it mean, or a month of sleepless nights. How can we identify if that's something we're struggling with right now?
Yeah, so the hallmark of a psychiatric diagnosis, so we never try to pathologize normal, which is a big way of saying if there's something that happens to you, if there are stressful things going on, stress is very, very common. And so, and then your reaction to stress can be a very normal experience. We try not to use normal as well, but it can be a very expected thing. We don't diagnose anxiety until you basically meet a list of symptoms, and those symptoms have to affect you in multiple ways and be impairing in multiple ways. Most times, either you have difficulty at work, difficulty with family or relationships, difficulty in school, that sort of thing. We call those kind of the major domains. And so, yeah, so if you are on a roller coaster and your heart starts beating fast, yes, you are nervous, you are worried, but that's not anxiety because it's not affecting you in multiple domains. And so, and words matter. So we, as kind of pop culture psychologists and psychiatrists, we use those terms a lot. Oh, I'm anxious. Oh, I'm bipolar. Oh, you're crazy. That sort of thing. First off, there is no such thing as crazy. So let me reassure you about that part. But anxiety in a situation like this, that is unprecedented, like meaning none of us have ever experienced anything like this. It is normal to be anxious. It is normal to feel your heart beating. So anxiety is, symptoms include, your heart racing, you feeling a sense of dread or a sense of that something bad is about to happen. You may get clammy or wet hands and start sweating. Some people have muscle tightness where you're grinding your teeth or your shoulders are getting really tight. You tend to get stuck on a topic and you go on it again and again and again. So all of those things can signify anxiety, and then depending on how long it lasts, if it's 6 months, if it's 2 weeks, if there's a specific trigger, then there are lots of little diagnoses that you can give depending on what's going on. But the key is to recognize, especially in a situation like this, that it is expected to be worried, and that is actually something that we expect to happen. But if you start to feel overwhelmed to the point where you can't function, you can't leave your house, you're afraid to leave your house, you're washing your hands a lot, and you're touching things a certain number of times, when you start to get into those areas, that's a cause for concern, and that's when we hope that you will reach out to one of us.
Thank you. And I know that for everyone on this call, your specialty are children, right? So you work very closely with children. I'm the mother of 2 daughters, and managing this process, not just for myself, but for them, right, has been a challenge in itself, because the worries that I have, I think I know are very different than the worries that they have as children. And so can you tell me how, if at all, this type of environment could have a potential impact on children, both in the now and then in the future?
So I'll jump in. I think in terms of how it affects children right now, one of the things that's difficult is that children cannot comprehend exactly what's going on. Just truly, their brain is not developed to the point where they can say, okay, I know this will have an end. I can recognize that this is hard. They can't really process those things. And so keeping in mind that they may hear bits of information from the news, or even updates that we have to give of, don't touch everything, wash your hands, try and cough in your elbow, those protective things we're having to teach our kids, they're trying to compare it to what they know. And some of what they know may be from movies, and they're trying to connect these things that don't make sense. And so sometimes that can be extra hard for them. So in terms of how it affects them right now, keep in mind that it's going to cause worry, because they can't fully understand those things the same way we as adults can understand and kind of rationalize our experiences. In terms of long term, that really depends. We as parents, as adults, as community members, we have a huge impact on kids. Really, we can set the stage of being able to normalize their feelings, just like we talked about, hey, it's hard for us as adults too. And with that, I think it's, where do we place the emphasis? So do we place the emphasis on how many people are dying in those statistics, or do we place the emphasis on, hey buddy, I know this is really hard and I see those hard feelings that you're having, and I know I miss my friends too, but hey, let's try and do these activities and focus on how great it is that we get to play more board games together, and finding those positives that have come from a very, very difficult time. So long-term effects, we'll have to wait and see. A lot of it is going to depend on what we take to be proactive now, and the focus that we put to try and help our kids now.
Sammy or Brian, do you have anything to add to what Stas gave us?
Yeah, I'll jump in really quickly. Yeah, so one of the things is that all kids take their cues from who they're around. And so whenever I'm counseling the parents that I work with, one of my attendings in residency said, anytime there's an anxious kid, there's always an anxious parent nearby. And so I will always say that in the office. I'll say, okay, who's the anxious parent? Who are they around? And it's just to Stas's point, when we control our own anxiety, because our kids take their cues from us, if we work on ourselves, then the benefits will also roll out to the people around us.
Thank you. Sammy?
Yeah, I can just speak a little bit about some things that you can do to help your kids out right now, because we've touched on that just a little bit. So music is ever present in our everyday lives normally, right? You go to the grocery store, you're in the car, you're listening to the radio, you're in gym class and they're playing music. If you're really little and in school, everything you're learning is through music. It's really everywhere we go, and now we're in this situation where we are seriously lacking sensory input, as well as for a lot of those kids an outlet. So just some little things that you can do to help them out with that are things like helping use music to establish a routine or a schedule. So obviously using music for bedtime, you should all sing to your kids. Studies show that it's important, so it doesn't matter if your voice is good or not. Singing to kids is good. Music has a very clear beginning and end. Wake up time, have a dance party in the morning, or have it before bed if that helps to get them calmed down. Not if they're the kind to get wound up. Things like that. You can make a playlist together as a family and say, okay, as soon as the last Frozen song is done, we're gonna have our shoes on. Things like that. Or as soon as, once that third song is over, all our toys are going to be put away. I will give the caveat, I'm not a parent, so I know that actually, putting this into practice might not work as beautifully as it sounds, but we do know that these things can work. Just sometimes it takes a little time, a little practice. But that way, the music makes it feel more like a reward than, okay, everything's done, cutting off by, use music as a nice friendly way to establish a routine or a schedule, and that way it's instilling some more normalcy for them too, because they're missing out on a lot that they would get normally.
So what I'm hearing is that when I put on my morning playlist and dance around the house as I'm getting ready, and my daughters tell me, Mom, that's so cringe-worthy, now I get to tell them that I'm just trying to help their mental health and that they should join in the process.
Absolutely.
Brian or Stas, do you have anything to add? Not just to, I'd like to hear any tips and tricks as a parent that we can use for our children, right? If they're feeling anxious, or if they're having a hard time. I know, they want to go see their friends, right? Or we walk past the playground, but we can't play on the playground, right? And so what are some things that we as parents can do to kind of help our children cope through this process? And then what are some things that we as parents can do, healthy things that we as parents can do to help us cope as we move along as well?
Yeah, so I'll go first, Stas, if that's okay. So I'm a big fan. So human beings love structure. We love order. We are not a chaotic being. So when there's anarchy and chaos and disruption, we actually don't like that a lot. And if you think about the pandemic, it is an exercise in disruption and lots of failures on multiple levels of leadership, which is why I'm glad that you're running for the state representative seat. And so what I encourage a lot of parents to do is build the structure into your kiddo's day. So even a visual structure. So in school, the structure is already built in. They know what time it starts. They know when classes are going to change. They know what the rules of the classroom are because they're literally posted on the wall. You can do that same level of structure at home, and you don't have to overdo it, but it helps ground the kiddo, who are even young kids or old kids. It helps to ground them to know what's expected, because in a time of a pandemic, we don't know what's coming. We don't know what is expected. And so I highly recommend like a visual calendar or a visual schedule, doing a brief check-in. And then with teenagers in particular. So there's a difference between latency aged kids, which are kids from like 6 to 12, and then your teenagers 13 to 17 or 18. They require a different set of skills. And so I teach a lot of my parents, when it comes to teenagers, the goal is to reflect back to them how they're feeling, but not to add anything. Don't try to synthesize, or don't try to problem solve for them, because kids that age can almost always manage themselves if you give them a little bit of leeway, give them a little bit of some activities to do, and even if not, they will find a way to entertain themselves. And you don't have to go overboard with the video games, because to Sammy's point, I mean, that's a lot of dopamine. A lot of dopamine is released with video games and telephones and tablets, that sort of thing. But with teenagers, in a sense, yeah, give them space, try to leave them be. And then with the latency age kids, with the younger kids, they just want your time. So even if you just sit and play Uno every day for the next 8 weeks, or you do Play-Doh, they want your time. So resist that temptation to go out and buy everything because you want to keep it changing. You don't have to change. They just want your time. Yeah.
Thank you. Stas.
I love the suggestions. 8 weeks of playing Uno every day would be really hard for me. So in terms of how do you take care of yourself to be able to take care of your kids, have some time for you as well. You have to build in that structure. And I think that's one of the hardest things for parents. The other thing is consider counseling for anyone and everyone. I think, Dr. Dixon mentioned it earlier, that there is no such thing as crazy. And a lot of times when we discuss counseling, it's, well, I'm not crazy, I'm not weak. And counseling is for healthy people. It gives you new ways to think through things. It's your place where you can release and not have to solve anybody else's problems, which as parents and as individuals in the community, sometimes we're doing that a lot. So go to counseling, learn some new ways to think about it, be able to release and have that time for yourself, because healthy people seek counseling. And when you set that precedent, it makes it a lot easier for kids to talk about their feelings. Now, there is a video on YouTube that I really, really like. It's Brene Brown, and it's Brene Brown on empathy. And you'll see a picture of like a bear and something else. And it talks about the difference between sympathy and empathy, and how when we want to really give empathy to others, to show that kindness, that it means connecting to hard parts within ourselves. So when our kids are having trouble, it doesn't mean we're having a meltdown with them, but it may mean we say, you know what, this is really, really hard on me too. And being able to voice those feelings and say, it's okay to do that. What do you like doing when you feel down? Here's what I do as a parent when I feel down. And that way you can set that example, you can talk about it with your kids, and you can get them involved with it. So just to summarize that, take time for yourself. I love the suggestions that everyone has had so far about having structure, having routine to the best that you can, finding those activities to spend time together to get that quality time in. And again, be willing to seek counseling just to find a safe place to release those feelings.
So that's great. And that actually leads me into my final question for all of y'all before we open it up to the audience. And that is, which Stas, thank you for saying that you don't have to wait until crisis to seek therapy, right? I did not listen to that piece of advice or know that piece of advice before I started therapy, right? It was the death of my mother that really pushed me into, seeking a therapist out and starting that process. And now I say the same thing, right? Like, I don't go to a therapist because there's something wrong. I go to a therapist to make sure that there's nothing wrong, right? Like to kind of
Yep.
keep that maintenance. But that's not the case for everybody. And it can be a very scary first step because there is that stigma, right, of weakness or something's wrong with me. But what I want each of you to kind of touch on is what are some things that folks can look for, symptoms or signs within themselves that it is definitely time to seek a mental health intervention, and whether or not, some suggestions as to which direction they take, right? Do I need to go see a doctor, or do I need to go see a counselor, or do I need to see both? Which one do I go to first? How do I find one? So I'd like to get your thoughts on that.
Yeah, I'll jump in first. So,
You caught my cue.
yeah. So there are lots of different signs and symptoms. So in the world of psychiatry, we literally have a book. It's almost like a recipe book. We call it the DSM of all the different diagnoses. And so I won't go through all of those because both Sammy and Stas have lots of things that they want to say, and I want to give them their time as well. One big sign that I would throw out would be if you wake up and you have a sense of dread, that is a time to go and talk to someone, because that means you're not looking forward to the day. That means that there may be things going on, stressful things that you're worried about. And that can be for any reason. If you just wake up with a sense of dread, or a sense of, I don't want to do this anymore, or I'm not looking forward to this day. I'd say that's one big sign. And as for reaching out and finding someone in the system, so the mental health system, the whole entire network is very, very siloed and fragmented. So we're all out there. We just don't. It's really hard to communicate and get in touch with each other. Whereas in the medical system, it's a lot more smooth. So if you get sick and you need to go to the hospital, it's a very kind of generally a smooth transition. And so I would say reach out. Just you can always start with your primary care provider. So your physician, your nurse practitioner, your physician assistant. You can also start with just Google, type in counseling or therapy. And generally, once you have one access point, even though it's still fragmented, they can do a pretty decent job of getting you where you need to go, keeping in mind that not everybody needs to start with medicine, and then that some people actually need medicine before the therapy. It just depends on what type of symptoms. And so rather than try to nail that down tonight, I would just say just reach out. When in doubt, reach out, and because once you get into the system, we can kind of nudge you to which way you need to go.
Okay, thank you.
So just to piggyback on that, I think when you're looking at whether or not to do counseling, one of the signs that we screen for as therapists is anything outside your normal. Are you sleeping more than normal? Are you sleeping less than normal? Eating more than normal? Eating less than normal? Do you find that you're worrying about things a lot? We kind of have like a 2-week marker that we ask people to evaluate. What does this look like over the last 2 weeks? Do you find that you don't enjoy things the same way you used to? I think Dr. Dixon is 100% right that just start somewhere, because the first step for a lot of people is overcoming just that fear of not knowing what counseling can be like. If you don't click with the first person, that's okay. Go to another one. Ask to see someone different. Don't give up altogether. If you have that gut feeling, kind of like Dr. Dixon said, of you're waking up with dread, or you notice that you just can't get the oomph to do things, no matter how much you want to, no matter how much you're pushing, you're just struggling, then that's a good sign as well to go seek help. And we will point and work with one another to try and get you connected where you need to go. I think sometimes people like to talk themselves out of counseling because of that fear of what it will be like. Again, it's supposed to be a safe place, and you want to find someone that you feel comfortable talking to. And if you do need medications, therapists will recommend that. Most doctors will also recommend if you need counseling. And then all of us work together to say, okay, music therapy could really help with that in another angle if this is too hard to talk about. So I think we can all work together in different ways. Just take the first step. Look at whether or not the last 2 weeks have been rather normal for you, or just go ahead and see a counselor so that you get over that fear, so that if maybe you're okay right now and you don't really need that support, when you do need it, you already know what to expect and you've already connected somewhere.
Awesome.
Absolutely. Yeah, I'm just gonna piggyback on what's already been said a little bit. I just want to, I guess, speak a word of encouragement for anyone out there who does want to take that leap into seeking therapy, because it can be really hard to find a provider. So you finally get the courage and you want to do it, and maybe the person you felt like was going to be perfect doesn't have availability. It's so important to stick with it though. It can be really discouraging. I'm just speaking from experience with me and with friends and family. You know, I know a lot of people have gone through this, but I just want to encourage you, if you have done a search before and it didn't come up fruitful, keep trying, because it's just so worth it. And I know that you both already spoke a little bit to the fact that it's important to do it while you're well. Because if you finally decide when you're in the hardest part of it that you do need therapy, it's going to be all the harder to go find somebody and to say what you need to say. But if you have a rapport established with somebody, you're comfortable with somebody, then when things get more difficult, it's just a little bit easier of a process. I think one other thing, other than noticing symptoms arise, another red flag might be realizing that coping skills or leisure skills that you've had before aren't working anymore, or that you don't enjoy them, or if symptoms do start to arise and then you realize you don't have coping skills. So maybe things were manageable before and they aren't now. So that can be an indicator that there's maybe some more processing that needs to go on, and that maybe going to see a counselor, they can help you kind of find the tools that you need. Yeah, I think it's pretty much it.
Thank you. We've got it looks like we have 2 questions from folks joining us, but before we open it up to questions, I lied. I have one last question. And this one is specifically for Stas. So I am looking for mental health, and my insurance, either I don't have insurance or my insurance doesn't cover it, and I need some therapy. Tell me where I can go to get that.
So, not that I'm biased, but there's this amazing agency called Alliance Child and Family Solutions. And right now we have a program. Sorry, I can hear my dog in the background. We have a program that will provide free counseling for anyone that has been affected by the coronavirus, whether that's a reduction in hours, in pay, another primary income earner lost hours or pay or however, or general financial difficulties because of it. So we are looking to get donations and grants to try and extend that so that can be a year-round program, but through August 1st, it's 100% covered. All you have to do is go to the website. It's www.acfstexas.com. So A like Alliance, C like Child, F is in Family, S is in Solutions, and then Texas spelled out.com. Complete new client forms just to say a little bit about what's going on and who you are, and there's a little box you can check so that you can get that COVID-19 hardship program so that your services are covered. And if you do have insurance, whether that's Medicare, Medicaid, commercial insurance, if you're somewhere far out in Texas and there's not providers, or you don't feel comfortable in an office, we have telehealth for all of Texas. So we can absolutely get you connected and get you in, whether you have insurance or financial means or not.
Awesome. And so one last friendly plug. Tomorrow is Giving Tuesday in North Texas. And so my question to you is, if I was feeling extra generous, is your organization part of the Giving Tuesday event tomorrow?
That is a great question. So Giving Tuesday Now, which is the event tomorrow, is actually a global generosity day. And so it is sponsored by a general organization, whether it's volunteering, fundraising on our behalf, or donating. All of those options are available when you go to our website and click Give in the corner. So in terms of are we participating, you can donate at any time. We'll hope you join the movement, that you tell others, that you share it with other people, and we can absolutely accept those donations, whether it's tomorrow or year round. And we can accept virtual volunteers if you don't have the funds but still want to make a difference. So we have lots of opportunities available, and so we would be more than happy to participate with that.
Awesome, thank you. So our first question is from Stephen.
Hi, yeah, so can you guys hear me?
Yeah.
Yes.
Oh, okay. Do you have any breathing techniques to use if you feel you're having a panic attack or experiencing anxiety?
I'll jump in, and then if anyone else wants to, they can. So one of the things I recommend is, it's called like the basic 5. When you think of your 5 senses, and I'm always missing one when I think of it, you want to try and hone in on those. So if you're having a panic attack and an anxiety, it's very, very hard to get yourself out of that. So if you say, okay, well, what's just 5 things that I can look around and see? And you can say, okay, I see a desk, I see a wall, I see a trophy, because again, I'm in my kiddo's room. And you name those 5 things. And then you say, okay, well, what's 5 things I can touch? I can touch my chair, I can reach here. It's going to help ground you as you go through every single sense, saying, what can I see? What can I touch? What can I hear? What can I smell? What can I taste? If you don't taste anything, go put an ice cube in your mouth. It will distract you, hydrate you, and it'll get you focused on the here and now. It's a quick way to get yourself out of that anxiety attack and thinking.
Thank you.
Yeah, I'll go ahead next. So there are so many different breathing techniques, you know, if you Google, but one cool thing, and I'm going to keep bringing up music because I'm the music lady, but our body's naturally entrained to music. Meaning, if you've ever walked and you're listening to music and you notice that you're walking to the beat of the music. So our breathing rate will do that too. So if you can find music that is preferred for you, that has a tempo that is at a steady, slowed breathing rate, you can put that on and entrain to that. And again, it's another distraction and it'll feel a little more natural in your body. I know for me, I've tried some breathing techniques where you're supposed to, you know, breathe in for 3 and then out for 9 or whatever. And the counting, I just can't do it if I'm too frazzled. But if there's music on, I can just go, okay, 1, 2, 3, you know, like that. So that's just one little tip, one way you can use music. And there are some, if you look on YouTube, if you find music to be relaxing, if you don't, it can be distracting for some people. But if you do, if that's a coping skill that you have, you know, you can go on YouTube and search music assisted relaxation, and so it will talk you through a deep breathing relaxation script. But then there's music with it too, if that's something that you prefer.
Thank you. Dr. Dixon, do you have anything for us?
Yeah, so, and this is why I love the interdisciplinary approach, because what Sammy and Stas are referring to, so those are very kind of action-based, right? Things to do. So there's also kind of the thinking behind a panic attack. And so if you take that cerebral, the cognitive approach, it's very much a panic attack or anxiety is a trick that your brain is playing on itself. It's your brain thinking that it's in danger when there's no actual danger around you. And so one of the techniques that I sometimes use is you basically count, and you count through the entire panic attack, knowing that at some point it's going to end. Panic attacks always end, so they will end. And then that going forward, you will know that your panic attack will never last longer than that time period. And so each one will get subsequently shorter, so that you can remind, it's basically you reminding yourself, positive self-talk, reminding yourself that you're not crazy, this will end. And that's a cognitive, a thinking approach that will work for some people. Other people, yeah, absolutely. Just what Sammy said, you need to, because counting may not work. There are tons of other techniques you can see on YouTube, as well as all the techniques that Stas mentioned, which are the grounding techniques. So all of those will work.
Awesome, thank you. I will share with you my favorite technique when I'm having a hard time at night and I kind of want to, you know, slow it down a little bit and get ready for bed is 4-7-8, right? So I breathe for 4, breathe in for 4, hold for 7, and then out for 8. And I do that until I kind of feel myself get ready for bed, or, you know, if I'm feeling that hurried feeling. So I know Sammy said she didn't like to count, but for, you know, for me, the counting is what works. It kind of slows me down. But I'm glad that I hope that gives you some ideas of some things that you can do if you're feeling not just in a full-blown panic attack, right? But if you're just feeling rushed, or, you know, a little anxious, or you find yourself needing to slow down and just take a breather, that's always a way to do it. And so we have one last question. Reem, are you there?
Yes.
Okay, what's your question?
So for extroverts, not physically being with people can be really difficult. So how do you recommend that they cope with their need to get that interpersonal contact with others?
Yeah, I can go. So I smiled when you said this, because I am an extrovert too. So I have some introvert friends who are pretty much like, you know, enjoying the alone time, and I had to really do some adjusting. Especially, you know, like Stas and Dr. Dixon, like we talk to people all day, and now we're home, and, you know, hopefully we're doing telehealth too, but you know what I mean? So, you know, finding any way to connect, I think that sometimes technology gets a bad rap, but there's a lot of positives to us having this at our fingertips. So whether you like to play video games, playing video games with your friends, scheduling calls with people, I know that's been really good for me. I'm not the kind of person who's just gonna pick up the phone and call somebody, but if, you know, with my family or with my friends, if we schedule, okay, we're gonna do a call on Monday and watch a movie, or we're gonna do a call on this night and play a game, that's been really, really helpful for me. And it gives me something to look forward to. You know, normally we have the weekend to look forward to. We're gonna go out to eat. You can still make these plans, and, you know, you physically can't be with those people. And when we can hug them again, it'll be so beautiful. But for now, there's a lot of ways that you can connect. And so you just got to find out like what works best for you and your people. Yeah, let me think if I mention everything. So video games, that can be a fun one. There are a lot of fun like family games that you can play like through these video platforms. There's a thing called Netflix Party. I think it's a browser add-on where you can talk to people who are watching the same movie, or you can be old school like me and my friends and just press play at the same time. And one thing that I started doing recently is making playlists with my friends. So I use Spotify. I'm not sure what the other, you know, music services can do, but on Spotify I can make a collaborative playlist, and then I can add my friends to it. And so it's not only a way for us to all learn new music, but it's like exciting to go on and you see that they've added a song, and then you think of them, and then, you know, it's just cool. I'm really mushy about music, obviously, but yeah, those are some things that you can do. I was just excited about this question because I feel you there.
Yeah. Anyone else?
Yeah, I have to go. No, Stas, go ahead.
Nope, you're good.
So it's really funny. So I'm an introvert that can act as an extrovert because that's just how the world works, right? So one of the best pieces of advice I got from a therapist that I was working with, I don't even know how many years ago. Most extroverts feel like they should be doing a lot of things. And she said to me, and I will never forget it, she said, be careful with the word should, because you'll should all over yourself, right? And so I put to y'all, this is an unprecedented time. There is nothing you should be doing other than registering to vote and making sure you get out to vote in the fall. Right? Other than that, yeah, take your time. You don't have to be the on person. You don't have to do anything. Yeah, just relax and go with the flow. So yeah, be careful with the word should.
Yes.
That was a good leeway. So I'm an introverted busybody. So I don't really like people, but I just like the opportunity to be in lots of places near people. One thing that I think is really helpful is if you look at the love languages quiz, I really like it. It talks about quality time, physical touch, gifts. It's got like a whole list of what speaks to you to feel most loved. So if it's something where it's physical touch, maybe you get a weighted blanket. And maybe you're sitting in a car and you're 6 feet away and you're talking to a friend or whatever it might mean. So for me, I have to take those times to run those errands just to be out, because I can't stay in one spot very well. So even just trips to the grocery store are really fun. So you have to find what is it that's filling you up the most, to where it's kind of like the most productive use of doing whatever activity to feel good. And then again, don't should all over yourself in things with productivity.
And thank you for that. And thank you for the reminding us that we don't have to do it all. You know, when I heard you all talking about structure, right? When this all first started, my kids were so sick of me saying, this isn't spring break. This isn't extended spring break. You have to get up, right? Like we have to maintain a routine. We have, you know, and I've stressed that to them, and much to their dismay, right? But then there's some days that I've let that go, right? And you're just like, can you do some school today? Can you, right? Like just give me 2 hours or give me an hour. And so when I heard you talking about structure, I thought, oh, wow, I probably don't have enough structure right now. But then I don't have to have all of the structure in the world, right? So thank you. Thank you all so much for joining us. It's a subject that's near and dear to my heart. And I hope that everyone on the town hall was able to take away something today from this and kind of apply it as we move through, you know, what is so cliche to say right now, but these very uncertain times. They are uncertain. We don't know how long or what the total impact will be when we get out of this. So with that being said, thank you all so much for joining us. If you have, please go to Stasa's website and donate. And if you need services, sign up. I would recommend reaching out if you need to each one of our professionals here, and they can always help guide you in the right direction if they're not the correct caregiver for you. But I just want to reiterate, don't wait until you're in crisis to seek help, because there's nothing more frustrating than trying to find that help when you need it and you can't. And so it's good to have locked and loaded when you know, ready to go as soon as, you know, you do need it. And if you don't wait, then you don't go into crisis, or it's less likely to go into crisis because you've got that. You've got that there. I know I personally am so grateful that I had been working with a therapist long before all of this started, because I think that if I hadn't, I might have found myself in one of those, you know, crisis modes, not knowing what to do as an extrovert that's now, you know, stuck at home for an indefinite period of time. So thank you all so much for coming out tonight. If you have any questions, please feel free to reach out to me or anyone on this call. There is a link to some additional information about mental health on my website, and we've linked Stasa's organization as well. So if you forget, you can always go to Elizabethport, Texas, and check that out. So thank you all so much for coming, and stay safe and stay healthy and stay happy. Bye.
Bye.